Hello everybody. I'm sorry I look like a hot mess. Oh my gosh, it has been such a long day. I wanted to make a video just because a lot of people are having questions and it's a lot to type out. So last Wednesday I was laying in bed and I guess my breast was hurting a little bit, so I just kind of reached over and I felt a huge bump, and I thought, well, maybe this is like a muscle or something, or a bruise, I don't know. So I reached over to the other boob and it wasn't there. And I didn't want to say anything to Chris because it was kind of late at night, like 3 o'clock in the morning at night. And so I waited until the next morning and I asked him to reach over and film me, and he freaked out. That day I went to the doctor. Last Thursday I went to the doctor, and I had a scratch in my belly button and it was kind of infected. So she's like, well, I'm more worried about your belly button. And she's joking around. She was really bubbly, and as soon as she touched my breast, she was like, we need to get this looked at, like, as soon as possible. You need to go in tomorrow. But she couldn't get me in that day, and she got me in today. And the reason that she got me in today was because diagnostics was there. And let me tell you, things moved so fast today. My day started at 8 o'clock. I went in and got all my paperwork and stuff filled out, and I went into the mammogram room, and she's like, okay, we're going to do 3 pictures on each breast. And she started out with my right breast, which is the one that is swollen. It doesn't necessarily, well, it hurts now, but it doesn't necessarily hurt. It's just this huge growth, and my breast itches and it's discolored and all of this and that. So she started taking the MRI or the mammogram, and when she got to the 3rd one, she was like, okay, we need to take one more picture. And I was like, okay. And she took another picture. And then she's like, okay, go ahead and sit down. I'll be right back. And she left, and she came back and she said, we need to take 2 more pictures, but we need to magnify it. And I was like, and she's like, don't worry, honey. I've seen cysts this big before. You're going to be fine. But when I left the room and she was walking and she was asking if I had any friends in my town, because I told her I didn't live in my hometown. And she's like, well, it's important that you have friends when you're going through something like this. And I was like, something like this? What is that supposed to mean? So I waited for like 2 minutes, and they swept me off to the sonogram room. And when they got the sonogram on, it was like nothing but black. It was like nothing but, that's all I could see is this black with a little bit of white. And but then I started seeing little bubbles around the black. It's like this great big mass with little bubbles all around it, just flaring out, which is why it feels so wide in my breast. I mean, when I cup it, I'm going to use the good boob. When I felt my lump, I could literally grab it with my whole hand. It went from here to here. And I'll be posting pictures that I took on Facebook and on Fitocracy if y'all want me to. So she left the room, and she came back in with a diagnostics person. And she was like, okay, and we found 2 suspicious areas. She's like, one obviously is the lump that you have. The reason we're very, very concerned is because it's a huge mass with multiple bubbles around it. Multiple lesions around it, I guess, or growths. And she was like, so, she's like, if it were a cyst, it would be full of liquid. But this is solid. She's like, it's just solid. And one of my 2 of my lymph nodes under my arm is a cause for concern. And once it goes to the lymph nodes, it's serious. And she's like, I'm just going to be straight up with you. I don't want you to wait. I don't want you to worry. I don't want you to sit at home for the next 2 days wondering if you have cancer. It is cancer. And, but we don't know what type of cancer it is. We don't know. She goes, from the biopsies, we can determine what type of cancer it is and the course of treatment that you need to take. And she's like, she's like, just the sheer size of this and all of the growths that, you know, she took me into the room and she's showing me my mammograms and she's like, all of these lesions that are around the tumor is basically what it's trying to do is your body is trying to fight off the cancer. And, but, so she sent me off and I got blood work done and I came back and I got an MRI. I can't really see it, but it's right there. And the MRI is like, for breast cancer, is like so weird because you lay on this table, you lay on your stomach on a table and your boobs are like hanging through these 2 holes and they put you in the MRI machine. When we got the MRI imaging, it's like, here's my boob, right? Right here is where the mass is. But then it's like all of these other little growths just spiraling in. And I have this huge vein that's just going right there to that mass. And basically that's how the cancer is growing. And the lymph nodes are there. And so I got my biopsy. And the biopsy was not as bad as I thought it would be. They biopsied my lymph node and they got 2 shots of the biopsy and I already have a bruise. It's so sore. It hurts so bad. I qualified for the Laura Bush Foundation, which helped me pay for my biopsy. I didn't pay for my mammogram or anything before I qualified for it, but it did pay. And I got to talk to Laura Bush. Like when the person came in, she was like, I have Laura Bush on the phone from the Laura Bush Foundation. She needs to ask you a few questions. And I was like, the Laura Bush? And she's like, the Laura Bush. This is our foundation. And she happens to be at work today. I was like, cool. And she just asked me questions like my name and my address and this and that. And that was it. She wasn't like, oh, so sorry, honey. But she wasn't like that. I have an appointment with my surgeon in San Antonio next Thursday. So if anybody's willing to watch Kaden during that time, that would be really, really helpful. I'm not going to take like any strangers' help, but you know, Friday I'll get the phone call and they'll tell me exactly what type of cancer I have. But I got everything today, and she was like, without hesitation, even after without hesitation with the MRI, she knew she knows. She's like, I'm not going to lie. She's like, I've been doing this for 40 years. And I went back after the sonogram stuff, and I talked to the lady that did my mammogram, and I was like, it's cancer. And I was crying. I was crying so hard. And she just gave me a hug, and she's like, I knew it was, but I didn't want to say anything because I'm not the professional. I'm just the technician. She's like, but I've been doing this for 30 plus years, and I've seen enough cancers rolling through here that I knew that that's what it was. And she's like, you'll be okay. It's breast cancer. So, but they think that it's very, very early. It's just a very fast growing breast cancer. It's just very fast. So it's been a day. And my boob is starting to hurt from the biopsies, and I am just so drained. But luckily my mom is keeping Kaden for the next few days because the biopsy is gonna, I'm already bruised. Because I talked to Devin about it, and he wanted to see where they did the biopsy, but I told him he couldn't see it exactly because I have to wear the bandages until tomorrow. And but there's already like this giant bruise around my nipple, like coming from the place where she did the biopsy. But I'm just gonna do this. I'm just gonna do what I have to do. I'm just gonna take it one day at a time. And going to fight for my family. I don't mind getting breast cancer. I knew that I was going to get it. I just am scared of being sick. And I don't want my kids to see me sick. And I don't want to cry because I've been crying all day and my face hurts. And my eyes are all blurry and my face burns. The tears burn my face today. But between my insurance, my supplemental insurance, the Laura Bush Foundation, and once you get the diagnosis in the state of Texas, you qualify for breast cancer Medicaid. Between all of that, the treatments and stuff should be taken care of. There's one test they want to do genetic testing to see if I have BRCA1 or BRCA2. And if I have the one that's for the ovarian or the cervical cancer, then when they remove my breast, they can remove my uterus and my ovaries and stuff, so I don't have to deal with that cancer, which is fine. I've already had my babies. I don't need my uterus anyway. But that is not covered by anything. That I have to pay that out of pocket, and it's $3,000. $3,000. It's gonna suck. So $3,000, and then of course I want to get a recliner, because after I have my surgeries, I'm not going to be able to sit down or lay down in my bed. I'm going to want a big recliner to sit in, because I'm going to use my jelly rolls, my loose skin for my weight loss, to reconstruct my breast. So everything is like really planned out, and I got all my packet information, and that's how they know. They just know. It's got dead parts to it. There's not any circulation going to the main stuff. It's all going to the outside of it. And it's so rigid. It's just like, it's like rigid, and then on some parts it's got other parts growing. It's like these giant bubbles, and it's like my whole breast is just full of cancer. So I'm gonna cut the fuckers off. Just take both of them. I don't want any of it. So just I'm gonna document everything. You can follow me on my journey. I won't always record on my iPod. I'll try and record on my camera most of the time. But anyway, I love everybody, and I'm just tired tonight. I think I'm just gonna go to bed soon. But I'll do another video on Friday once I know exactly what kind of cancer it is. That's all we're waiting on. It's cancer. We just don't know what kind. It's not she doesn't think it's inflammatory because the skin around my breast is not inflamed on the MRI or on anything. Like, my skin is fine. But then again, she can't be sure because she just knows it's cancer. She just doesn't know what kind. So we'll know Friday or Thursday. Whenever she gets the results, she said she'd call me. And I was like, that's fine. Okay. Anyway, I'm rambling. I could do that all day. I have so many thoughts going through my head. And check your breast. Girls, men, women, check your boobs. I'm only 31. 31. I have 2 kids, 6 and 2. And I'm fixing to start this battle. I'm ready. I'm ready. I'm going to do this. And if anyone on Fedocracy, you need to do something special, like I don't know, because I want to walk during chemo and stuff, but I want to log it and be like, battling chemo, battling cancer, and going on walks. Can I just, like everything I do on Fedocracy, can I just do it on the most extreme level because I'm going through chemo? Let me know, Jen. Let me know, Mr. Fedocracies. But anyway, bye guys. I'll keep you posted on everything.